millions of women have been unnecessarily suffering through menopause due to a decades-long misunderstanding about hormone replacement therapy, HRT. But here's where it gets controversial. The FDA has finally removed the ominous black box warning label from HRT products, sparking both relief and debate. This move comes after years of advocacy from doctors and women who felt misinformed about the risks and benefits of HRT. In the early 2000s, 2 studies linked HRT to significant health risks, including breast cancer, leading the Food and Drug Administration, FDA, to slap its most severe warning label on these medications. This decision caused a dramatic drop in HRT usage, with countless women avoiding it out of fear. But was this fear justified? The FDA now says no, and this is the part most people miss. The studies that fueled these fears had critical flaws, particularly in how they accounted for the timing of HRT initiation. Current evidence suggests that when started before age 60, or within 10 years of menopause, HRT's benefits often outweigh its risks. FDA Commissioner Dr. Marty Makary didn't hold back, calling the demonization of HRT one of the greatest mistakes in modern medicine. He emphasized that an expert panel reviewed the latest research and unanimously recommended removing the warning. Hormone replacement therapy could improve women's health outcomes more than almost any other intervention, Makary stated, drawing parallels to the impact of antibiotics or vaccines. This decision isn't just about labels, it's about restoring trust and access. Dr. Rachel Rubin, a leading physician in this effort, described the change as revolutionary, noting that women and doctors had been advocating for it for decades. The American College of Obstetricians and Gynecologists, ACOG, also celebrated the move, stating it would enable more informed, shared decision-making between patients and clinicians. But let's not forget, HRT isn't risk-free. It still requires careful consideration and a prescription. Dr. Stephen Fleischman of ACOG reminded us that, like all medications, its use should be tailored to individual needs. So, here's the question. Will this change how you or someone you know approaches menopause treatment? And more importantly, how can we ensure doctors are equipped to prescribe HRT effectively, given the historical lack of training in this area? Health and Human Services Secretary Robert F. Kennedy Jr. praised the FDA's decision, calling it the result of a thorough, evidence-based review. But the real work is just beginning. Dr. Rubin highlighted the need to educate clinicians on prescribing HRT and having nuanced conversations with patients. The labeling was one hurdle, she said, but now we need to address the knowledge gap that's been a disaster for women's health. This shift marks a turning point in menopause care, but it also opens the door to critical conversations about women's health, medical misinformation, and the importance of individualized treatment. What's your take? Is this a step forward, or are there still concerns that need addressing? Let's keep the dialogue going, because when it comes to women's health, every voice matters.